Gresham College presents Acting on Evidence, How Medical Research Has Informed Historical Drama by Professor Dr Powell.
Buried within the minor credits of some of television dramas, you'll see a line for medical consultant or medical advisor. And this lecture hopes to illustrate that role and to describe how medical advice is provided to television dramas, and specifically historical dramas, where I've been lucky enough to work over the last few years. And I hope to explain how medical experts bring authenticity and, on occasion, creativity to drama productions. For reasons which I will explain, but have more to do with chance than design, I've developed a particular expertise in historical medical drama, and actually in one 10-year time period between 1909 and 1918, which is interesting, but just by chance. And so what I want to do in this talk is discuss my work on Casualty 1909, which was set in 1909 in the London hospital, on Downton Abbey, which is a drama series on ITV you might have heard of, which started in 1912 and is now up into the early 1920s, I think, and Spanish Flu, The Forgotten Fallen, which was a film made for the BBC, which is set in 1918. First of all, though, I'd like to tell you a little more about me and how I got interested in this kind of work in the first place. So, as you very kindly said in your introduction, I'm a professor of public health medicine. I work for NICE and I work for the University of Oxford. And my own research, rather incongruously in this setting, is on e-health and the use of new technologies in healthcare and the internet in healthcare and this sort of thing, the NHS website. So what I research is how, from a public health point of view, how we can get the population to live more healthy lives, cut down on their salt intake, take more exercise, etc., through using new technologies like the internet or mobile phones or text messaging or whatever. And so that's my interest. And yet I've developed this particular interest in Edwardian medicine. And this was purely because through my work in this area, this sort of cutting edge, I guess, or the 21st century healthcare, I took on a role advising a BBC program which was looking at this, which was looking at, it was a drama program set 5 to 10 years in the future. The idea being that it would showcase new treatments in medicine and new ways of doing things. So looking at sort of stem cell transplants and gene therapy, et cetera, et cetera. We worked on that program for about 2 years, and it never got made, which tells you something. It tells something about the timescales of drama, and it also tells you something about the sort of sometimes the disappointments of the sort of television production, because you can sometimes go a very long way with something and then it doesn't come to fruition. So, but during the course of those 2 years making that or working on that program that never got made, I obviously built up a lot of contacts in this area, and through that I got involved in Casualty 1909, and then through Casualty 1909 I got involved in Downton, and through Downton I got involved in Spanish Flu. So more by chance than by design, but I'm pleased that I have done. Okay, so the process by which a television series is made is obviously variable, but for me these are the main milestones that I've observed, and it's a fairly linear process, and you could probably guess most of these yourselves, but it starts with an idea, obviously. It's the concept. And then the concept, if people like that, is worked up into a treatment. Now, a treatment is about a 10-page document which describes the characters and what might happen to them and some of the plots, etc. And then if someone likes that, it becomes a first script. Now, all of these generally, and again, there's obviously variety, but concept, treatment, and first script tend to happen with an independent production company and a writer, and they take a punt on something and invest in something and take it to that stage. You then try and sell that first script to the television company, BBC, Channel 4, whoever, and at that stage, generally, it gets commissioned, and there's a series of scripts made. It goes into production, which is the shooting and the actual the work of the actors, and then there's the post-production and the editing, etc. of the program altogether. Medical advisor can work at any of these stages, and again, I've been lucky enough to have worked at all of these stages, and at the moment, working on a concept and treatment around the life of Jon Snow. So you'll all be familiar. I imagine most people will be familiar with the pioneering anaesthetist and epidemiologist Jon Snow, who was around in sort of Victorian London and in the sort of 1830s, 40s, 50s. Really was one of the very first people to embrace the new science of anaesthetics, and also then during the cholera outbreaks of particularly of the 1854 outbreak, was the one who showed the link between the water supply and the outbreak of cholera. So at the moment I'm working on that at a very early stage, concept and treatment. And similarly, I've been involved at the very final stage in post-production. So one example was on Downton, where they'd done a scene and they weren't quite sure that they'd edited it together in such a way that it showed the... it was actually, if anyone saw Downton on Sunday night, just gone, it was the eclampsia scene from that, and they just wanted to... the actress Jessica was fitting, and they wanted to know that the fitting looked okay on the cut, on the edit. So I've been involved in the post-production, but mainly the role of the medical advisor is in the middle here. It's on either working with the writer or the script editor on getting the script accurate, authentic, maybe the language, but also sometimes the stories, and I'll talk more about that, the actual plot. Or it's in the production phase and being on set and making sure it looks right and the actors are doing the right thing that you might expect. Now, I mentioned authenticity, and I sort of trying to find the right word when I was writing this, whether authenticity was the right word, because what I don't mean, and I make no apology for really in this, because it is drama, it is fiction, is what I don't mean is 100% accuracy. There have to be compromises in drama. I would argue that there have to be compromises. And it's more about believability and a sense of authenticity sometimes than it is about being 100% accurate. And where you often have to make compromises is around time, compromises that dramas make all the time. It's not specific to medicine, but it's around time compression. Things happen too quickly, and you know, disease progression or relief from treatment, etc. It happens too quickly. And coincidence, so time compression and coincidence. So these compromises that drama make all the time, that the same person wouldn't see the same rare illnesses day after day after day, or the same person wouldn't get the same illnesses or whatever, but time compression and coincidence. And I'm going to show some clips and some stills from some of the programs we worked on just to illustrate that later. The other thing, so I mentioned authenticity, the other thing I mentioned is the role of the advisor is around sometimes creativity in advising on plot. And I think the practice of medicine is itself so full of the elements of drama, strong characters, life or death stakes, opposing moral values, narrative twists, unexpected outcomes, that the very clinical practice, my clinical practice, other people's, is drawn on often by the writers to come up with ideas to shape the plot. So often, and again I will illustrate this later, but you're drawn into a situation where they know where they want to go with a story, but they need the disease or the medical procedure or whatever to take them there. So they know they want, I'll come back to that when I get onto the clip to explain that. So if you did see Downton on Sunday night, and I apologise if you're waiting for the repeat because I've just spoiled it. But anyway, Lady Sybil has a beautiful baby girl. And if you don't want me to spoil the ending, look away now. But so in this story, they wanted there to be a tension between the family doctor and the doctor from London, around what they should do about her worrying symptoms, signs of protein in the urine and headaches and high blood pressure, etc. So essentially she had preeclampsia. And so part of my role is to make them call it toxemia, because that's what they would have called it in those days. And part of my, so there was just simple stuff around language. Part of my role was on set to make it look like she might be someone suffering from eclampsia, which is very difficult when you have a very beautiful young actress like Sybil, who just didn't look ill no matter how much makeup they put on her. Although I think actually the end result was very good. I won't spoil that further in case you want to watch the episode later, but I'll talk more in detail about this episode. Now, for those of you who've been following Downton for a while, this is Series 1, Episode 2, so the second ever episode. Excuse me. So, in this episode, and again, this to illustrate the sort of work of the advisor, and I'll talk in more detail about this episode. We have a man called Mr. Drake, who's top left there, who's not very well, and Dr. Clarkson and Mrs. Crawley. And for those of you who don't watch Downton, Dr. Clarkson is the sort of local cottage hospital doctor, and Mrs. Crawley is a newcomer at this stage to the village and wants to make herself useful, and used to be married to a famous paediatrician. This is the backstory you get, and is a nurse herself, and used to help her husband in his practice, and so is quite skilled herself. And I mean, I have nothing obviously to do with this. This is what they want to happen dramatically, is that there is some clash between the sort of the newcomer with her sort of increased knowledge but lower status in professional terms, and the local doctor who has obviously been there for forever, but isn't necessarily up to date with the latest things. And then and as the advisor, you're presented with this. We want this clash. We also want to introduce this character, Mr. Drake, who comes up later in some further episodes, a sort of local farmer in his 40s, and we want him to have something potentially fatal, ideally to do with his heart, and we want some life-saving procedure that the local doctor might not be familiar with or have done, but which she has seen and is very enthusiastic about. And so you're given these sort of parameters to work with. And so I go back to the journals. I mean, obviously use my medical knowledge, but you also have to think what's around in those days. And so what we came up with was a pericardial effusion in a young man, so probably secondary to rheumatic fever, which was relatively common in those days. Now, you don't necessarily get all this in the actual drama, and this is one of the things. Sometimes they just need to know a sort of plausible backstory, so they know that this could have happened. It might not actually be played out in the drama, but they just want to know that potentially they could have a young man on the ward who's seriously ill with a pericardial effusion. And I say, well, yes, you can, because he could have had rheumatic fever. And then I go back to journals from the time, often the BMJ, because all the BMJ's back issues are all online since 1840 or something. I can't remember when they started, but they're all there for anyone to access. And then buried within these journal articles, because of the style of writing journal articles in those times, there's often case studies. And so it's not hard, once you know what you're looking for, that you're looking for a pericardial effusion, it's not hard to find a case study of a pericardial effusion from a sort of contemporary source. And so this one, as it happens, this is a 27-year-old woman but who didn't have a history of rheumatic fever, but it's really to illustrate the sort of case history we would find, and it would tell me, interesting, these case histories almost always end with a post-mortem, which again tells you something about the time. And it tells me about the pericardium being hugely distended with this light amber-coloured fluid, and I talk to my cardiology friends about what colour it would look like with rheumatic fever, and they say, well, it'd probably be a bit more straw-like, and then, well, but for the drama they wanted it more, they wanted the blood, they wanted to see the blood because that was more dramatic, and you think, well, it's possible there could be some sort of hemorrhagic element to it. And so this is what I mean about being authentic, but not necessarily 100% accurate at all times. It needs to be credible. So if, to some extent, can you get away with it? And so what happens next is a script arrives where your comments have been incorporated, and you check this and you check the wording, and you might make some comments on that and the language and say, well, actually they wouldn't have used those medical terms in those days because they used other ones, like I said, the toxemia example rather than preeclampsia. And so in this one, I don't know if you can see that, but you come up with a form of words which, from medical advisor's point of view, you're happy with, sort of, are genuine. Your heart is not functioning properly. As a result, your pericardial sac is full of fluid. We call this tamponade. I'm proposing first to withdraw the fluid and then give you an injection of adrenaline to stimulate the heart and restore normal activity. So, not the most sort of succinct lines, but they sort of conveyed what was intended. And I think, obviously, of the three shows I've talking about today, Downton's obviously the one that I'm talking about it because people have heard of it, but it's obviously the one which is least medical. Obviously the main thing about Downton is not related to the medicine, whereas the other two shows, which I'm going to go on to talk about, are. And so I think in Downton is where you probably make most compromises. But it's about trying to show a sort of believable story. We had to have a drainage of this effusion. You discover that there are things like companies which supply historical medical equipment, and so you turn up on set and find that what they've supplied is this rather curious double valve syringe thing, and so you work with what you've got. And you will have seen you read about pericardial tamponade, pericardial effusion drainage in contemporary accounts, and you find that they always used to go in just next to the sternum and pointing up towards the shoulder. They don't always do that these days, but that's what they did then. So you sort of do the best you can with getting it accurate, in order to support the story they want to tell. So, I just turn my attention briefly to Spanish flu, The Forgotten Fallen. Now, this was a film made by Hardy Pictures for BBC 4. I think it was repeated actually on BBC 4. I don't know if anyone saw it about 3 or 4 weeks ago, at the end of September. And this dramatised the story of James Niven, who was medical officer for health in Manchester around the time. In fact, he was medical officer for health in Manchester for about 50 years. I think he was quite a well-known figure of his day in the public health world. Excuse me. And in the flu outbreak, so I'm sure everyone will be familiar with sort of H1N1 Spanish flu outbreak of 1918-19 killed, well, the estimates vary, but somewhere between sort of 20 and 50 million people worldwide, depending how you count them. And Niven was an early and fairly lone voice in Manchester, warning people about the impending outbreak of flu. And his particular thing was about contact between people, and he was very keen that people in Manchester didn't mix during this time, and that he tried to shut down major events and etc., so that to stop the flu spreading until the vaccine was available. And so it's interesting, when you get into the drama and writers' minds, they wanted to tell the story of the Spanish flu outbreak. It hadn't really been told that much before on the screen. And it's interesting that to tell that story, you need to personalise it, and you need to have a strong sort of protagonist, if you like, who's Niven, sort of leading the fight against the virus. My role in that one, so the Spanish flu was written by Peter Harness, who's a brilliant writer. I wasn't involved in the script at all on that one. My involvement came much later when they were filming, and was actually, I think, instigated by the BBC Compliance Unit. If you don't know, the drama, BBC, I don't know if it still does, BBC has a drama compliance unit, because it was being filmed when we had our sort of mini pandemic, the flu, 2 or 3 years ago. It was being filmed at the same time, and they wanted to make sure that the show didn't do anything to needlessly alarm people, but equally was faithful to the story of Spanish flu. And this is where sometimes your role as medical advisor sort of takes off in other directions. So I found myself with that show on BBC Breakfast with Bill Patterson talking about the show, and then being asked questions about the current flu epidemic. So you have to be sort of on your guard. Fortunately, I'm a public health doctor, so actually flu is one of the very few things I can talk about. That's Spanish flu. Finally, I wanted to spend some time talking about Casualty 1909. Now, I don't know if anyone saw Casualty 1909, which is set in the London hospital. There was a Casualty 1906 and a 1907, and then there was a 1909. And I think 1906 was the pilot. There was 1 episode, and I think 1907 there were 3 episodes, and I wasn't involved in those. And my involvement came with Casualty 1909, which was 6 episodes broadcast 3 years ago. And the idea behind these really came from the producer and director Bryn Higgins, who works at Stone City Films, and his grandfather had been a surgeon at the London hospital at this time, and he had his grandfather's diary. And that was the sort of acorn that started the idea to fictionalise or to dramatise, and I do actually mean I dramatise the goings on at the London hospital in that time period. And it was the more you sort of delve into what was actually happening there, the sort of more intriguing and interesting it is. I mean, some of the most well-known surgeons of the day were practicing at the London, and some of the main issues of the day, for instance, around anaesthetics, which was a major issue in the sort of first decade of the 20th century. But the sort of the evolution of the specialty of anaesthetics, the anaesthetist emerging as a sort of respected practitioner in their own right, rather than surgeons doing their own anaesthetics or having sort of assistants doing anaesthetics. But the emergence of anaesthetics as a specialty, and also some of the controversies around the use of which anaesthetic and spinal anaesthetics, etc., was all around this time period. So that was a major theme for Casualty 1909. And I'll talk some more about that in a minute. I also need to here just credit Jonathan Evans, who's the archivist at the London Hospital, who was historical consultant on this series, and his contribution was far greater than mine, and his archive is one of hundreds of case notes and ward diaries and autopsy records and committee reports, etc., from the London Hospital, and that archive was the sort of route for much of the stories that found their way onto the screen.
Minister, esteemed guests, ladies and gentlemen, it requires greater courage to make yet another speech before you on behalf of the hospitals of this great city than you probably suspect.
Mr. Fennick, I feel you ought to know. I've only ever done this. Administered anaesthetics, I mean, in training.
There's nothing to it. Stuffist. Shall we make a start?
There was a flash on the old street window. Funny thing is, I knew it was. There was a bomb, I just knew.
I saw him running away just before it happened.
Нет, я тебе говорю, я не видел ни одного.
Never seen these men before.
Будь человеком, наконец, и подумай о своем народе.
Very funny.
I said stop it.
You know what bothers me about people like you? You give Jews a bad name.
You stay on your knees and see where the promised land gets you.
In a moment, I shall need you. Get a coal ready.
To receive the prestige.
Is it your habit to complete the sentences of every doctor you assist?
She's as stubborn as a mule. So am I.
Sister, could you take over for me here?
Dr. Culp, I'm not authorised.
You are now.
Do you know what I like to do after a day like this? I buy a ticket for the tram. I sit on the top deck. I feel the wind in my hair. Would you care to join me?
Surely can't tempt you.
We're together at last.
That's nonsense.
Am I delirious?
Your heart is damaged.
I'm going to die.
Yes.
At any moment.
Yes.
No pulse.
Well, you don't need a post-mortem to tell you what he died of. For the coroner, swelling of the brain as a result of the anaesthetics.
A lay committee is not qualified to deliberate on medical matters.
Does one need to be a doctor to identify an untimely corpse?
Spinal anesthesia is in its infancy, Sydney.
If I were 10 years younger, I would invite you outside.
If you were 10 years younger, Mr. Fennick, then you too would realise that Stovane is the future.
If you live in the jungle, you have to be prepared for jungle ways.
I don't follow.
The Aliens Act is true. We let in thousands of them.
Interrogating patients.
I've made my decision.
Are you sure you haven't let them make it for you?
Please move out of the way, Doctor.
Tomorrow. I'm a policeman, not a philosopher.
And I soon will be tremendous change. You only have to open your eyes. To open your mouth.
Sit!
That men will rise up from their servitude and achieve universal justice.
So, you got a flavour of it there, and I'll talk about a few specific issues. I mean, one of the main stories where there was an anarchist bomb in the East End, and so that's what they were talking about there. And that was the guy with the back exposed with all the sort of shrapnel injuries. That was from the bomb, and so it's set in the receiving room of the London hospital. So essentially, that's why it's called Casualty, 1909. And so we had a lot of fun with thinking of and looking back in the archives of the sort of injuries and illnesses that would present to a receiving room at that time. And obviously what you want to do is to play to a certain extent to the ones that are unusual now, but were common then. And that the guy who was dying, and they were telling me he was dying, for example, was had Addison's disease secondary to tuberculosis, because it's something that is less common these days. But it was nice to show it in context. I'd like in the final part of the lecture to talk about three of the main characters who I think we saw all of them then, who were all surgeons at the time at the hospital. One was Henry Percy Dean, who was the guy with the sort of twiddly moustache. He was a surgeon and teacher of operative surgery at the London Hospital, and he was the one who was advocating Stovane and spinal anaesthesia. But what we know about Dean, and we know this from several sources, was his sort of predilection for tropane alkaloids didn't just stop at Stovane. He was a cocaine addict himself, and he became a leading figure in the introduction of spinal anaesthesia. He wrote a classic paper on this in 1906. And we had in Casualty, he had lines such as observe how the possibility of surgical shock previously common in abdominal surgery has been all but eliminated by the use of Stovane anaesthesia. So we were sort of playing to what we knew of Dean. But then if you go back to the medical journals, this is from the BMJ of 1931. We have an obituary for Henry Percy Dean. And it states, if he had fulfilled the promise we who were associated with him at the London Hospital 35 years ago perceived, he would have died the leading surgeon of his time. He seemed destined to reap the highest rewards his profession could confer on its most distinguished votaries. What happened, I cannot tell. All I know is that some tragedy in his life robbed modern surgery of a man who, if things had been otherwise, would have left on its progress an enduring memorial. And this was all Dean's cocaine addiction, which we had played out in the drama, and we showed him increasingly taking cocaine, and reacting to it, and we also showed his operative performance, if you like, dropping off. And it's interesting that he, by way of postscript, in 1913, he was retired from the active staff of the London Hospital at the age of just 49 to take up a teaching post. And so, to illustrate this, we had a fictionalized mistake. In fact, we have two fictionalized mistakes. One is with a spinal anesthesia gone wrong, which we saw a bit of the patient there with his legs, but where there was too much anaesthetic was given, and that he was anaesthetized for far too long below the waist. And the other mistake we have him making is in a hysterectomy. He ruptures a ureter while operating on. Actually, no, I'm sorry. We changed that. He was missed the diagnosis of a ruptured urethra in a pelvic operation. So we sort of tried to illustrate his sort of performance deteriorating. So that's top left, played by Paul Hilton, Henry Percy Dean. This is the patient with where he messed up the anaesthetic. And I thought I'd show you, just while we're sort of looking at this picture, just see some of the sort of more behind the scenes interest, really. Nothing to do with my job as medical advisor, but it's interesting. So you see they're on a ward there, and you look out the window and you can see the buildings opposite, whereas actually the ward was all made out of sort of plywood. The tiles were just painted wood, and out the window was just a screen of another building, and almost all of Casualty 1909 was filmed in a warehouse in Manchester. And you have a sort of little wooden box like that, and on the inside you have the operating theatre. This operation here, this was, we wanted to show Dean at his, this was one that Dean got right. This was at the beginning, before his sort of performance dropped off. So we wanted a sort of unusual operation for him to be sort of getting his teeth into and showing the medical students in this operating theatre with a gallery. And so again, I went back to the journals. This is from the BMJ of 1912. And it's a case of fractured pelvis complicated by laceration of the femoral vein, treated by lateral vein suture. And it gives a lovely description of, on inspecting the abdomen, groins, a large swelling about the size of a melon was seen, filling up and mapping out Scarpa's triangle on the right side. So you look for sort of unusual case studies that you can take and put into the script. And so, I don't know if you can read that, it's quite small, sorry, but in the top is an excerpt from the script which says, "My intention now is to isolate and remove a sharp spicule of bone that has broken away from the pubic crest and penetrated the femoral vein." And that was lifted, I lifted that directly from the 1912 article. So I've highlighted there in the 1912 article, it says, "A sharp spicule of bone broken away from the pubic crest has penetrated the vessel just as it came under Poupart's ligament," which didn't, sadly, reference to Poupart's ligament didn't get into the final version. I'm going to briefly rush through the next couple of things. The next character we looked at of these sort of great characters of the time was Leigh Culp, who at the time was working in the receiving room of the London Hospital. Later on, he became one of the leading figures in medical psychology. He was one of the first to describe psychological treatments for PTSD, post-traumatic stress disorder, because, of course, working at the time around the First World War, and he became president of the British Psychological Society and a professor at the London School of Hygiene and Tropical Medicine, but we had him when he was a young house surgeon working in the receiving room. But we could sort of, this is, you can think that someone who's going to become that person. We had him taking a great interest in some of the psychological backgrounds of people who were coming through the receiving room. But we also had fun with all the different illnesses and injuries that he was dealing with. So we had there was the bomb in the East End, the anarchist bomb in the East End. We had a fire in a sweatshop. I was very pleased. We even had a lion bite, which I found in an American journal of the time, but was for a travelling show or travelling circus that happened to have a lion in a cage. So we had, in one very, very brief scene, we had a man with a lion bite. This was the shrapnel, the back injury, and I might talk about prosthetics very quickly, or perhaps leave that for another time. But the prosthetics people are amazing, and this is just a plastic sort of thing put over that man's back, and then they're fantastic with what they sculpt in prosthetics. But then they're makeup artists, and they make it up to look amazing. And then finally, to talk about Henry Head, who people may have heard of, famous neurologist, obviously from the time, very appositely named, that's our Henry Head, played by Anton Lesser. This is the real Henry Head, bottom right, who again was one of the first people to get interested in post-traumatic stress disorder, amongst many other things. And one of the very famous things Henry Head did, which I guess some people here will know, is that he did an experiment on himself with in association with W.H.R. Rivers, where he had his own radial nerve, severed to study what effect that would have on his sensation and whether it would recover. And we know that the account of this was written up in 1908, so we had to play with time a little bit. But we know that Henry Percy Dean performed that operation. He performed it in 1903, but we had him perform it in 1909. And it was written up in Brain, which of course he went on to be editor of. And there's a fantastic description in there of the incision, 6.5 inches long, was made in the upper bicipital fossa, extending along the axial line, etc. So we knew exactly what happened. So that's all I wanted to tell you today. I hope you've learned something about the work of the medical advisor on historical dramas. I was advised to stop a few minutes early in case anyone had questions.
Do you ever clash with people who make the prosthetics and the people... You mentioned that you turn up on set and there's ancient medical equipment. Do you ever think, well, that isn't quite right?
Yes, and but there's several answers to this. You learn quite quickly you have to make compromises. There isn't a sort of career in being a medical advisor. Do you know what I mean? You're generally called in very last minute, and you sort of parachute in and parachute out again of this whole big production that people have worked on for months and etc. And so you have to make your impact very quickly, and often necessities and other invention or whatever, you've got to work with what you've got. They've got to shoot the scene. These are the only items they've got, and so you make the best you can, and you learn that compromise very quickly. There was, on Casualty 1909, they had a machine they really wanted to use, because I think they either had the original or from some museum, or they knew it had been at the London, and it was a magnet, a really strong magnet. And they wanted to use it to get shrapnel out of this guy's back. And I was saying, well, why would you wouldn't do that. If you want to get shrapnel out of this guy's back, you would just use your fingers. Do you know what I mean? You wouldn't be pulling it out with a magnet. And we sort of talked about whether they could come up with some sort of eye thing or something, that it might be useful for them. But in the end, basically, there I felt so strongly that we just cut it, and that was gone. So I think it's not a black and white thing. There's a sort of sliding scale of compromises, and sometimes there's a compromise too far in that case, and I did just say, no, I can't do it. But generally, you do need to work with what you've got.
Thanks very much. Some years ago, there was a campaign, I think, by the Health Education Authority to make people wear seatbelts that used gory pictures of people with facial injuries. And these were withdrawn because it was found that people withdrew from them. They withdrew from them. One of the trends in medical dramas in films over the last few years has been the increasing proportion of gore compared with the spiritual aspects that used to be the meat of A.J. Cronin and people like that. Do you think that's had an effect on people's response to health education and also to the healthcare in general? And incidentally, was that a chloroform bottle I saw in the London film?
Yeah.
A jar, pressurised bottle, as it were.
Yeah, it was. There was chloroform and ether, and yes. I think you make a very good point, but I have no, nothing further to add because it's sorry. Because I hadn't considered it before, but I think you're right in that they, and perhaps that's fueled by being able to make the gore more realistic, the prosthetic advances. I mean, what they do with the prosthetics is amazing, and they do produce them very, very quickly as well. So, but I don't know what effect that has. I can't answer that, but it's a good point. Yes, I think it's a very good point. I don't know whether it does. I think we've got time for one more. Is that right? Because yeah.
Just a quick one. Was I correct in assuming that you said that there is a company which supplies old medical equipment?
Yes.
Because I'm afraid I recognise those things.
Yes, and again, this comes down to you work with what you've got, and the process, and like if there was a career in being a medical advisor, and if you were involved at the very beginning, and then these things wouldn't happen because you'd be involved. Right? But how it works is that the art department will liaise with the supplier of historical medical equipment, and a box will turn up. For example, on Downton for the episode just broadcast. I don't think it made the final cut anyway, but they were checking her. It might have. They were checking her blood pressure, and the blood pressure cuff supplied for something set in 1920s had Velcro on it. But fortunately, we spotted that, and there was time enough to take the Velcro off, and but you don't, it's not an ideal world. You don't have the run in and lead in as the medical advisor to make sure everything's in place. You turn up and there's a box that's arrived.
For all information, please visit www.gresham.ac.uk.